There is a conversation happening right now in living rooms, kitchen tables, and doctors' offices across America that most people are not prepared for. It is the moment when a senior who thought they understood their Medicare coverage opens a bill, receives a penalty notice, or discovers that a medication they have taken for years is suddenly no longer covered, and realizes for the first time that a decision they made months or even years earlier is now costing them money they cannot get back. I have seen this happen to people who were intelligent, careful, and well intentioned. I have seen it happen to retired teachers, former business owners, military veterans, and lifelong professionals. It does not happen because people are careless. It happens because Medicare is one of the most complex systems in the entire American healthcare landscape. And the mistakes it punishes most severely are often the ones that seem the most harmless at the time. My name is Dr. Sarah Mitchell, and on this channel, we are committed to giving American seniors the healthcare knowledge they need to protect both their health and their financial security. Today, we are addressing one of the most requested topics from our community: Medicare mistakes. Specifically, the 5 mistakes that I consider the most financially damaging, the most commonly made, and this is the part that matters most, the most completely avoidable once you understand what to watch for. Whether you are approaching Medicare eligibility for the first time, whether you have been enrolled for years, or whether you are helping an aging parent navigate their coverage, everything I am about to share is directly relevant to your situation right now. Pay close attention because some of these mistakes carry consequences that follow you for the rest of your life. Let us begin with the first mistake, and it is one that surprises people every single year because it catches them at a moment when they believe they are doing everything right. When you turn 65 in the United States, you become eligible for Medicare. Most people know this. What far fewer people understand is that eligibility and automatic enrollment are not the same thing. There is a specific window of time called the initial enrollment period, and it opens 3 months before your 65th birthday, includes the month of your birthday itself, and closes 3 months after. That is a 7 month window in total. If you do not take action during that window, if you assume that Medicare will simply begin on its own, or if you decide to delay because you feel healthy and do not think you need coverage yet, the financial consequences can be severe and permanent. Missing your initial enrollment period for Medicare Part B triggers a late enrollment penalty. That penalty is a 10% increase in your Part B premium for every 12-month period during which you were eligible but not enrolled. In 2025, the standard Part B premium is $185 per month. A single year of delay raises that to approximately $222 per month. 2 years of delay raises it further. And this is not a temporary penalty that goes away once you enroll. This penalty is added to your premium permanently for as long as you have Medicare Part B. For a senior who lives another 20 years after enrolling, even a modest penalty can translate into thousands of additional dollars paid over a lifetime of coverage. Many seniors make this mistake because they believe they are automatically enrolled in Medicare when they turn 65. That is partially true, but only for a specific group. If you are already receiving Social Security benefits when you turn 65, you will generally be automatically enrolled in Medicare Parts A and B. But if you have not yet started collecting Social Security, as is increasingly common among Americans who are delaying their benefits to maximize their monthly payment, you are not automatically enrolled. You must actively apply. And many people simply do not know this until it is too late. There is another scenario that catches people off guard. Many seniors approaching 65 are still working and covered by an employer health plan. They assume that as long as they have coverage from their job, they do not need to worry about Medicare. In some cases, that assumption is correct. If you are actively employed and covered by a group health plan through an employer with 20 or more employees, you can generally delay Medicare Part B without penalty. When your employment ends or your employer coverage ends, you enter a special enrollment period of 8 months, during which you can enroll in Part B without facing a late penalty. But here is where many people make a critical error. If you retire and instead of enrolling in Medicare, you elect COBRA continuation coverage, That COBRA coverage does not count as creditable employer coverage for Medicare purposes. The late enrollment penalty clock continues running. Seniors who elect COBRA at 65, thinking they are protected, often discover months later that they have incurred a penalty they cannot erase. The only protection is knowledge, knowing the rules before you need them, not after. The second mistake is one that costs seniors money every single year, not through a penalty, but through a quiet and steady drain on their household budget that goes unnoticed precisely because it feels like a routine expense rather than a correctable error. Medicare's annual enrollment period runs every year from October 15th through December 7th. During those weeks, Medicare beneficiaries have the opportunity to review their current coverage, compare it against available alternatives, and make changes that take effect on January 1st of the following year. The vast majority of seniors do not use this opportunity. According to data from the Centers for Medicare and Medicaid Services, nearly 7 in 10 Medicare beneficiaries stay with the exact same plan year after year without conducting any review at all. That statistic represents an enormous amount of money left on the table. Here is why this matters so profoundly. Medicare plans, particularly Part D prescription drug plans and Medicare Advantage plans, are not static. They change every single year. The list of covered medications, called the formulary, can change. The tier at which a specific drug is covered can change, moving a medication from a lower cost sharing tier to a higher one and significantly increasing what you pay out of pocket. The premiums can change. The deductibles can change. The network of physicians and hospitals covered by the plan can change. A plan that was the most cost-effective option for your specific needs in one year may be a significantly more expensive option the following year, even if nothing about your health situation has changed at all. Research from the Kaiser Family Foundation has found that nearly half of all Medicare Part D participants could save hundreds of dollars annually simply by switching to a plan that more closely matches their current prescription needs. The Medicare Plan Finder tool, available at medicare.gov, allows beneficiaries to enter their specific medications and compare the total estimated annual cost across all available plans in their area. This tool exists specifically to help seniors make informed decisions during open enrollment, yet millions of people never use it. They receive their annual notice of change from their current insurer, the document that details every modification to their plan for the coming year, and they set it aside without reading it. Or they read it and assume that because they are familiar with their current plan, it must still be the best choice. That assumption costs American seniors hundreds of millions of dollars every year in aggregate, and it costs individual families hundreds of dollars each year that could remain in their retirement savings. The third mistake is connected to something that Medicare explicitly promises to cover, and yet remains one of the most misunderstood areas of the entire program among the seniors who would benefit from it most. Original Medicare, meaning Medicare Parts A and B, covers an extensive range of preventative services at no cost to the beneficiary. This includes an annual wellness visit, which is a scheduled appointment with your physician focused specifically on health screening, risk assessment, and preventative care planning. It includes screenings for conditions including cardiovascular disease, diabetes, certain cancers, depression, and osteoporosis. It includes vaccines for influenza, pneumonia, hepatitis B, and COVID-19. All of these services are available to Medicaid beneficiaries with zero copay and zero deductible, meaning they cost you nothing out of pocket at the time of service. Data from the Centers for Medicare and Medicaid Services reveals that only 30% of eligible Medicare beneficiaries used their free annual wellness visit in 2023. That means 70% of seniors left a benefit they have already paid for through decades of payroll taxes completely unused. The financial consequences of this are significant and compounding. Preventive screenings are designed to detect health conditions in their early stages, when treatment is less intensive, less costly, and more likely to be successful. A diabetic condition identified through a free screening and managed proactively costs a fraction of what it costs when it progresses undetected to the point of serious complications. A cardiovascular risk identified through a no cost wellness visit and addressed through lifestyle or medication changes can prevent a hospitalization that costs tens of thousands of dollars. The return on investment for using Medicare's free preventive services is not just medical, it is directly financial. There is a distinction that many seniors do not understand and that can result in unexpected charges at what should be a no cost appointment. Medicare covers a wellness visit at no charge, but it does not automatically cover a separate sick visit conducted during the same appointment. If your physician addresses a specific symptom or medical complaint during what was scheduled as a wellness visit, that portion of the appointment may be billed separately and may be subject to your Part B deductible and coinsurance. The safest approach is to schedule preventive and sick care as separate appointments when possible, and to ask your provider's billing staff in advance to clarify how the visit will be coded before you receive a bill you were not expecting. The fourth mistake is one that I find particularly important to address because it involves a moment that many seniors experience with a sense of relief and celebration, the moment they choose a Medicare Advantage plan. And yet, it is a decision that can create significant financial and medical complications when it is made without a complete understanding of what is actually being chosen. Medicare Advantage plans, also known as Medicare Part C, are offered by private insurance companies approved by Medicare. They combine hospital coverage, medical coverage, and in most cases, prescription drug coverage into a single plan. Many of them offer additional benefits that original Medicare does not cover, including dental care, vision care, hearing aids, gym memberships, and transportation to medical appointments. Their premiums are often very low, in some cases $0 per month beyond what you already pay for Part B. For a senior looking at a monthly budget, the combination of extra benefits and low premiums can make a Medicare Advantage plan appear overwhelmingly attractive. And for many people, these plans work very well. But there are critical limitations that are not always emphasized in the marketing materials or in the conversations that happen during enrollment periods. Medicare Advantage plans operate through provider networks. This means that the physicians, specialists, hospitals, and other healthcare facilities that are covered under your plan are specifically designated, and using providers outside that network may result in significantly higher costs or no coverage at all, depending on the type of plan you have selected. In 2025, Medicare Advantage plans can have out of pocket maximums of up to $9,350 for in network services and up to $14,000 when out of network costs are included. For a senior who enters a plan based primarily on its low premium and attractive extra benefits, and who then develops a serious health condition that requires frequent specialist care or hospitalization, the out of pocket exposure can be substantial. The most important thing to verify before enrolling in any Medicare Advantage plan is whether your current physicians and the hospitals you would want to use in a medical emergency are included in that plan's network. Network compositions change annually. A physician who was in network when you enrolled may not be in network the following year, which can force you to choose between paying out of network costs and finding a new provider. Before making any decision, contact your doctors directly and ask their billing staff whether they participate in the specific plan you are considering, not just whether they accept Medicare in general, because accepting original Medicare is not the same as being in a particular Medicare Advantage network. The fifth mistake is one that operates silently, generating unnecessary expense month after month, while the senior paying the bills has no idea that relief is available to them. Medicare beneficiaries with incomes above certain thresholds pay an additional surcharge on top of their standard Part B and Part D premiums. This surcharge is called the Income-Related Monthly Adjustment Amount, and it is determined by the Social Security Administration based on your tax return from 2 years prior. In 2025, the standard Part B premium is $185 per month, but a beneficiary whose income from their 2023 tax return exceeded $106,000 as a single filer or $212,000 as a joint filer pays additional monthly surcharges ranging from $74 to $443.90 on top of that standard premium. Similar surcharges apply to Part D drug coverage. Here is where the costly mistake occurs. The Social Security Administration uses your income from 2 years ago to determine your current surcharge. But income can change dramatically from one year to the next. A senior who retired mid year, sold a property, took a large distribution from a retirement account, or experienced any other significant income event in the year that becomes the basis for the surcharge calculation may be paying a premium level in 2025 that no longer reflects their actual current financial situation. If your income has declined significantly since the tax year being used to calculate your surcharge, you have the right to request a reconsideration from the Social Security Administration. This process involves submitting documentation of the life changing event that caused your income to decrease, and if approved, your premium surcharge can be recalculated based on your more recent and more accurate income. Seniors who do not know this option exists continue paying elevated premiums indefinitely, sometimes for years, without ever knowing that a straightforward appeal could reduce their monthly costs significantly. The broader lesson that connects all five of these mistakes is one that I want every person watching this video to carry with them. Medicare is not a passive system. It does not automatically give you everything you are entitled to. It does not automatically correct errors that were made at enrollment. It does not automatically find you the best plan, remind you to use your free preventive benefits, verify that your doctors are still in your network, or lower your premiums when your income changes. All of those things require you to take action, to ask questions, to review your coverage, to understand the rules, and to advocate for yourself within a system that is genuinely complex and that carries real financial consequences for those who navigate it without adequate information. The seniors who protect themselves most effectively are not necessarily those with the highest incomes or the most sophisticated financial backgrounds. They are the ones who stay engaged. They review their annual notice of change every fall. They use the Medicare Plan Finder before the enrollment deadline. They schedule their annual wellness visit every year without fail. They ask their doctors specifically whether they are in network before making plan decisions. And when their income changes, they contact the Social Security Administration and request a reassessment of their premium surcharge. These are not complicated actions. They do not require a medical degree or a law degree. They require awareness, and they require the conviction that your retirement savings are worth protecting with the same diligence you applied to earning them. That is exactly what this channel is here to provide. Every video we produce is designed to give you the specific, accurate, actionable information you need to make better decisions about your health care and your financial security. If today's conversation was valuable to you, I encourage you to subscribe so that you never miss a new video. Share this with a family member or a friend who is approaching Medicare eligibility or who has been enrolled for years without ever conducting a coverage review. The information we share here is free. The cost of not having it can be thousands of dollars. Thank you for spending this time with me today. On this channel, Dr. Sarah Mitchell, Senior Health, we believe that every American senior deserves to understand the system that serves them. Because better information leads to better decisions, and better decisions lead to healthier, more financially secure lives. Until next time, protect your health, protect your savings, and protect your independence.